The topic for today is one that hits home to us all: protecting our children and elderly. If you are a healthcare auditor, you can help your organization stay in compliance of reporting potential neglect and abuse. Please watch this entire video, which is not all-inclusive and does not serve as consulting or legal advice. But we do give you food for thought and a place to start with a new auditing program with impact and meaning. The contents of this video has been written by our CEO, Joanne Byron, a nurse, consultant, and healthcare corporate trainer with over 40 years of healthcare experience. This article addresses how internal auditing and monitoring programs can help detect potential issues, increase compliance to state mandatory reporting requirements, and improve the quality of care, and is based on Joanne's blog article entitled Auditing to Protect the Vulnerable in Our Society, written August 2020. Urgent care, emergency departments, primary care providers are all typically the first to identify specific signs and symptoms of abuse and/or neglect. Please note that the presence of warning signs does not necessarily mean abuse or neglect. What it does mean is that further investigation and reporting may be required. On July 10th of 2020, the OIG published results of an investigative audit. Experienced auditors know that if the government is auditing a specific target, healthcare providers should be conducting internal audits to ensure compliance. The OIG's auditors reviewed the medical records and other documentation to determine whether they contained evidence of potential child abuse or neglect. It was then determined whether the incidents of potential child abuse or neglect were reported to Child Protective Services and other appropriate agencies. The previous year, in June 2019, the OIG published their investigation results of incidents related to skilled nursing facilities. Through this investigative audit, the OIG determined that an estimated 1 in 5 high-risk hospital ER Medicare claim for treatment provided in calendar year 2016 were the result of potential abuse or neglect, including injury of unknown source of beneficiaries residing in a skilled nursing facility. There are two primary category codes to audit, T74 and T76. Let's start with T76 Category Codes. When a T76 code is assigned, it reflects suspected cases of audit and child abuse, neglect, or maltreatment. Both Category T74 and T76 requires a 7th character to report additional information about the encounter. Codes starting with T74 fall into a category which reports adult and child abuse and encompasses neglect and other maltreatment which has been confirmed by the provider. The category description is on this slide, but look it up in your code book as well. For confirmed cases, the external cause code section X92 through Y09 should be reported along with documented injuries. A perpetrator code Y07 is reported when the person who performed the abuse or neglect is known. Let's review Y07 next. Y07 is the code to report with a T74 code for a confirmed case. Selecting the correct perpetrator code is based on the relationship between the victim and perpetrator, which includes abandonment, emotional neglect, mental cruelty, physical abuse, physical neglect, sexual abuse, and even torture. Each organization should have policies and procedures reflecting state mandatory reporting of adult and child abuse, neglect, and maltreatment. Is your organization compliant? If not, claims data could reveal non-conformances identified through government audits. In conclusion, it is recommended to establish an audit program to detect potential situations of abuse and neglect and verify that your providers are appropriately reporting such cases as mandated by state law. Get legal counsel involved regarding audit nonconformances and establish training and retraining programs for providers in coding such situations. Learn more about documentation and coding requirements. Consider training as a professional auditor and certify. Our Auditing for Compliance program is online and on demand. Visit our store for more information at www.aihc-assn.org. I hope you enjoyed this compliance and auditing tip today.